Hi everyone, Shannon Gontu here. We've got a great guest today to answer one of your questions. Remember, if you have any mental health or wellness questions that you want an answer to, just go ahead and DM us and we will get that answered for you by a professional in the field. Today we have Scott Salath with us. He's a licensed clinical psychologist of over 18 years, and he's currently in private practice and clinical faculty with Spalding University's School of Professional Psychology. He has worked in schools and hospitals and community mental health, and he really has developed a passion over those years for helping clients learn how to utilize all the skills for their personal lives, but along with psychological medications to really assist with their lifelong journey and therapeutic process. He has taught clinical psychopharmacology at Spalding for 5 years and still enjoys assisting those students and his colleagues and clients understand more about the medications, their side effects, and all sorts of expectations to have for those. However, in his clinical work, he is not a licensed prescriber. He really knows a lot about them. He's going to drop some knowledge on us today about it and answer a question that we had about psychological medications. If you guys want to get in contact with him for clinical services, he does see individuals and couples, and you can simply just Google his name. It's Scott, and then last name is Salathe. But thank you, Scott, for being with us today. Our question for you is, how do I know which psychological medication is right for me?
Well, thank you, Shannon. Thank you for having me.
Yeah,
It's a great big question, so I'm going to jump into this, and I'm going to organize my answer here in about 10 points here to
perfect.
keep myself and everybody else on track here. So the first thing that you want to do in figuring out which medicine is right for you is to find a good prescriber that can help you to figure this out. Choosing a medicine should be a collaborative process that you do with your doctor. You may have a little prompt or hint from your therapist if you're working with one, but the biggest piece is finding a doctor that you know and trust and will work with you to find the right medicine for you that matches your diagnosis and your symptoms.
Yeah.
So, the first thing that you really need to do from there is identify um, which doctor potentially in your orbit might be able to help you. And so people generally have two options there. They can go with one of their primary care doctors or they can go with a specialist. So I'm going to talk about both of those pieces. So primary care doctor might be your family practice doctor. Um, it could be a pediatrician if it's the case of a child or adolescent, or it could be a OBGYN or internal medicine doctor. All those are considered primary care doctors. And they're really great when you have maybe a mild to moderate mental health issue and you only need one medication and maybe you've been taking it for years or you need a slight change. Doctors like that are great with that and they usually feel pretty comfortable prescribing one psychiatric medicine and
Mhm.
adjusting the dose.
Yeah.
But if you have a more complicated issue, more complicated diagnosis, or maybe you don't know what your diagnosis is, or maybe you need two or more medicines, then you're going to need a specialist. You're going to need a psychiatrist or a psychiatric nurse practitioner. Psychiatrists are doctors that have gone through medical school and done additional several years of training and residency to specialize in mental and emotional illnesses and the medicines that treat them. And psychiatric nurse practitioners also go through many years of schooling. I'm not sure exactly how many, but many, and
Mhm.
are also very skilled in prescribing psychiatric medicines. And they have four initials after their name, APRN, which stands for Advanced Practice Registered Nurse. Okay, and they're also excellent. So, psychiatrist or nurse practitioner is what you would need if there's a more complicated situation or you're dealing with two or three medicines.
Mhm.
So, the other thing that you would want to do to prepare for your first visit, this would be like number three here, is that you'd want to tell the prescribing doctor if anybody in your family has had a similar mental health issue and if they've had success or severe reactions to a similar medicine that may have taken. For instance, if there's another family member who had ADHD, maybe they had success with Ritalin or maybe they had not a good experience with Adderall. That would be a
Mhm.
very important thing to tell the doctor or nurse practitioner, and that can help them have some clues about what might work for you.
Yeah.
Number four would be that once you have a good solid diagnosis, your doctor, and a medicine prescribed, and you filled the medicine and you start to take it, like what to expect now. So the next several that I'm going to talk about is what to expect. So the first thing is that unfortunately, you have to wait a little bit for the good effects to come. This is what we call the therapeutic effects, and they come eventually. With most medicines, I'm going to say 90% of the medicines in the psychiatric universe are called steady state medicines. In other words, they take weeks to build up in your bloodstream fully, right, until they're at maximum dosage. So usually in the first week, they may be at 20 or 25% effectiveness. And then in week two, maybe 40 or 50%, 60, 70. It can take 4, 6, sometimes 8 weeks for them to get fully in their bloodstream.
Mhm.
There's a few medicines that are exceptions to that that start working right away on the first day. Those would be ADHD medicines like Adderall and Ritalin and all their derivatives, and some of the anti anxiety medicines like Valium and Xanax and Klonopin. But other than those, almost all the other medicines, they take time. So the bad news is we have to be patient to let the good therapeutic effects kick in. And we have to be also patient and tolerant with the side effects, which unfortunately kick in sooner. And
Yeah.
that's number five, is to expect some side effects to kick in first.
Yeah.
And they usually kick in the first few days. The good news is they're usually mild and they're usually transient, which means temporary. And they also usually fade or completely stop in the first week or two. Now, that's obviously a big generalization. Many, many things can happen because I'm talking about dozens and dozens of different medicines. Um, some of the most common side effects are for people to have a bit of an upset stomach, sometimes for people to feel a little lethargic or a little sleepy, or for sometimes people to be a little amped up and have a hard time falling asleep. Most of those are known side effects. Some of them will ramp down in time, and if they don't, that's definitely something to talk to your prescriber about. Of course, if you had a severe reaction, a severe rash, if you started vomiting, if you had terrible diarrhea, anything that was really an intolerable side effect, that's something you want to contact your doctor about and talk about stopping your medicine. And they'll advise you on how to do that. And that depends on how many days you've been taking it. Okay. So just to summarize those two, unfortunately, the side effects may kick in first, and then the therapeutic effects kick in later.
Mhm.
Then we talk about coming back for maybe your second visit or your third visit with your doctor, and how do you prepare for that? And the best thing you can do is be prepared that they're going to ask you at least about four things: your mood, your energy, your sleep, and your appetite. So just expect those questions. And if you can prepare a little bit of how you're trending on each one of those, if you're trending up or trending down or kind of in a wobbly direction, um, or any other pattern that you see, that would be enormously helpful to your doctor because that's what's going to help them to determine how to tweak your dosage.
Mm.
Okay. So if you can prepare for your visit, that's going to make your visit go even better. And that's number six.
Yeah.
Number seven is expect the tweaking the dose to take many weeks, several visits perhaps, and maybe over the course of a few months to get the medicine just right for you. Now, of course, this starts with finding the right doctor, getting the right diagnosis, then the right medicine. And then this step now that we're talking about is tweaking the dose to get it just right for you so that we get the right balance of the best therapeutic effects and the least amount of side effects. And that's sort of a balance and a ratio. And that's tricky chemistry. And that's why the doctor and nurse practitioner's gone to school for a long time.
Yeah.
Yeah. Yeah.
I've
So
always heard it
that's
kind of as like it's like a moving target. Like it's very different for everyone. The target looks very different for everyone, but it's also like ever changing and evolving and moving.
Yes, yes, it certainly can be. Um, so there's many variations in that. So the best thing with that is to keep an open mind and let your doctor give you advice on why they might want to bump it up or bump it down, or tell you whether you take it in the morning or the evening or a split dose or other creative things.
Mhm.
Okay. Now, again, it's best for your doctor to be working with you on this rather than for you to Google this because you'll just get a wide variety of conflicting information.
Yeah.
Number seven is, well, actually, I just went over number seven. Number eight is expect your medicines to work better if you're also doing therapy. At this point, we have almost 50 years of research to show that in most conditions, most of the time for most people, medicines work better when you take them regularly and you do your therapy regularly. Now, this one's kind of a common sense one, but unfortunately, a lot of people will just do one or the other. Some
Mhm.
people put all their eggs in the basket of medicines and don't do enough therapy. And some people put all their eggs in the basket of therapy and don't use medicine to kind of lubricate and facilitate the process. When you have a serious mental health issue, serious depression, bipolar, schizophrenia, PTSD, and many others, you often need both. So you definitely want to try to use both of those collaboratively and keep both your doctor and your therapist informed on what's going on the other side of your treatment so that they can pair them together and work together. And
Yeah.
sometimes even a phone call or an email in between the doctors is not a bad idea.
Mhm. And like you mentioned before, your therapist, if you have a relationship with a therapist, they can be a really great resource in exploring these conversations with you. Though most therapists, aren't clinical prescribers, we have relationships with prescribers and can help you kind of navigate that kind of role and world as well.
It's a great point, Shannon. And your therapist is your point person because you may see them more often and they may have a simple answer for a simple question to you. Or if it's a more complex question, they may help you to kind of hone your question down and narrow it so that you have a good, concise question to ask your doctor the next time. They may also be able to help you of if that's an immediate question that you need to call your doctor about immediately or something that you might wait a week or two until you see your doctor the next
Mhm.
time or an emergency situation where you might need to seek hospitalization. So again, run through all that's good to run through your therapist and they may be able to help you with it. It could be something simple.
Mhm.
Number nine is expect your therapist to discuss with you realistic expectations of what you can expect from your medicine and also the functional impact of what the medicines may have on your real life. Whether your medicines might make you a little bit sleepy or whether they're going to help focus you and give you more energy or whether they have a little bit of some troublesome side effects that you have to manage, and how you would manage that within the scope of your life and your job and your
Mhm.
kids and your family and your sleep and wake cycle and all the other nitty gritty things. Because prescribers are so busy, oftentimes you may only get 10, 15, or 20 minutes if you're lucky with your prescriber, but you may get 50 to 60 minutes with your therapist. So you have time to talk about how this medicine is impacting your life, and again, how you might tweak your life to also fit your medicines. So that's number nine. And then number 10 is generally stay away from Dr. Google because you're just going to find thousands and thousands of pages and so many resources that you may not be able to tell up from down and what's good information, what's not good information. And it may be confusing and conflicting to you. So, in general, you want to use your doctor and your therapist as your point people to give you good information about what medicine you're taking.
Mhm.
um, I would point you there are some good sites out there where you can learn about the medicine that you're taking. You can learn a little bit more on WebMD or MayoClinic.com. They're reliable, solid sources of information. Again, those are better once you do have a clear diagnosis and a clear medication that you're already taking to learn more about those. Keeping in mind that you will not get every side effect that's listed, so try not to freak yourself out by that.
Mhm.
Um,
Yeah.
that's my top 10 list of things. I don't know if there's any other pieces, Shannon, you'd like for me to comment on.
No, it's so helpful, and also to point out like that expectation piece is, expectations are really tough in lots of spaces to navigate, but especially with medicine, where typically maybe we have headaches, so or body aches, we take a Tylenol, or we have whatever it may be. Like we're really waiting to see like this is going to fix something, and so
Mhm.
that kind of space for the expectations for psychological medications is that there's so many other factors going on, and we're living life like we don't live in a bubble, and so
That's right.
there's really not that. I hear a lot of the word kind of like wishing that there was a magic pill that could just solve everything or make things go away or whatever it may be. And it just may not feel like that. It may feel like kind of less foggy up there or whatever it may be. It's not a magic pill.
You know, you're so right about that. There's very few magic pills out there. I tell most of my clients that if you can find the right medicine for your diagnosis and the right dosage, you might get 25 to 50% relief from some of your symptoms. So at best, it may get you kind of halfway home. The other half is going to be therapy, as well as your own homework and meditation and prayer and exercise and taking care of yourself. All those things are super important too. So we definitely don't want to put all our eggs in the basket of medicine. But sometimes they can be very helpful to kind of lubricate the process and make everything work a little bit better.
Yeah.
Or as one of my old mentors used to say, it gets your brain ready to learn. Um,
Mm.
so whether that be for school or in therapy or whatever else you may be learning to live your life in a more um, healthy way.
Yeah. Yeah. I really like that because it's really tough um, to learn if it's, yeah, super foggy up there or chaotic or kind of like I always say, like, you can't do calculus if a tiger is chasing you. So it's like
That's right.
if things are going all sorts of ways, it's going to be really tough to
That's right.
sit down and write that paper or to do your work or whatever it is.
That's right. A little extra help. Then we have to do the work.
Yep. And then we can step in for sure.
Yeah.
Well, thank you so much, Scott. That was all so helpful. And guys, remember if you have a question, whether it's mental health or just wellness related, we know lots of professionals in the field that we can get on here to answer your questions and educate and normalize all types of mental wellness. But remember, if you want to get in contact with Scott for individual or couples counseling, just simply Google his name. His website will pop up and you guys can get in touch with him. But until next time, thank you, Scott. Thank you, guys.
Thank you.